So welcome to you all. I'm Jess Thorpe, the Research and Content Lead here at Nimbus 90, and I'm delighted to welcome you to the second episode of a brand new series of the Chief Disruptor Breakfast Club. This series is called the Innovation Mindset, and what we are doing is looking at different areas that are critical to driving innovation forward. And today, we're going to look at how data is the backbone of innovation, but particularly in the fight against COVID-19. So today's guest disruptor is Dr. Mark Coté, an expert in digital culture and big data and society at King's College London. So before I welcome Mark formally, I wanted to talk a little bit and thank everybody for joining. We have more people joining the Chief Disruptor Breakfast Club each week, members and partners of our community, from large scale enterprises to small and medium ones and to startups, from academia, a really broad range of people interested in understanding more about innovation. And Nimbus 90's role is very much to connect you, a forward-thinking community of business and technology leaders, to fuel innovation and inspire change. And change at the moment, as we know, is absolutely all around us. So as we enter a new phase of reduced lockdown in the coming weeks, Chief Disruptor Breakfast Club is here to expand the mind and deliver some insight, along with your coffee, of course, to power up the grey matter and inspire you with ideas as teams and organisations adapt to different ways of working and some of the different behaviours that we're seeing emerging. So I am about to interview our guest disruptor, Mark, but as ever, please submit some questions as and when they come to you. There's a special Q&A box right at the bottom of your screen, and if you pop any thoughts in there, then we'll try and get through as much as we can. And I will fire as many questions as I can to Mark at the very end. So over to the main event. I'm really delighted to spend this morning speaking to Dr. Mark Coté, and he leads work at King's College London on the analysis and impact of big social data. And he's an expert really in how ordinary people can use big data as a community resource and to affect change. Mark, welcome to you.
Thank you very much for having me. It's nice to be here in my own home, looking at everyone out there.
Exactly, fantastic. So Mark, we'll dive into what you do, because essentially I've introduced you as an expert. Your work focuses on, I suppose, the societal impact of big data and also the digital human and data culture. Can you tell us a bit more about this area of study and why it's important at the moment?
Sure. I want to give maybe a bit of an unexpected response to why it's important. And I'd like everyone just to think about the status of being human. And I want to make a case that the human has always already been a technical being. I mean, if we were to go back, say, 3.3 million years or so ago to the Lemekwi Valley in northern Kenya, we would find the oldest stone tools. And those stone tools were made by hominins, but they predated not just our species, they predated our species by some 3 million years, but our genus, Homo, by 500,000 years. They had a cranial capacity that was about 1/3 of ours. So what we see is that the emergence, even physiologically, neurologically, of what we consider to be human-like came about in a deeply recursive relationship with technology. So when we're talking about data in our current historical moment of datafication, and by datafication, I just mean that unprecedented exteriorization of our actions, of our thoughts, of our beliefs, of our likes, our dislikes, our movements, of our lives. Well, this is a process that happens in a way that we don't consciously consider. We don't say, how much data will I generate today? But we're endlessly generating discrete data points, and what's crucial is the ways in which those data points can be combined in different ways for different purposes to very different actionable ends, some of which are highly desirable, but not all. And we need to ask, is it being done in a manner that is fair, that is equitable, and if it's beneficial, for whom and for what? So for me, to study these processes of datafication is to think about what it is to be human right now. And as we're seeing right now, the conditions for being human can change really, really quickly.
Yeah, absolutely. And thank you so much for that introduction. Firstly, for the context in thinking of us as technical beings, not just in today's world, which is highly technologized, I think, but also, I mean, we're in the realm of zettabytes of data now. I had to look up how much that was. I mean, mind-boggling quantities of data about us,
Yes.
and much of which we don't even realize is out there. So clearly, a critical area of study, and I think has very interesting read across and principles for businesses who, many of whom I think are nascent with respect to data culture and what that means. So I'm sure we'll circle back to some of that in a sec. Let's zone in a little bit on the pandemic and what's happened, because we want to sort of drill down into what COVID-19 is teaching us about our relationship with data, about society's relationship with data. My sort of feeling is that as the pandemic really escalated in the UK in particular, there was intense debate around the credibility of data sources, how data is interpreted and analysed. I saw quite a lot of tweets of people saying, you know, people can't interpret stats, that, you know, that kind of thing. So has COVID-19 affected public trust in data practices, do you think?
Yeah, I mean, I think trust is really the core issue when we're talking about the very possibility to use data, to use mobile apps as a means to address the pandemic. I'd like to ask everyone just to take a brief moment and to think back in terms of monthly milestones. And just to ask yourself, I mean, what would your level of trust have been when the lockdown began on the 23rd of March? What might it have been about a month later on the 23rd of April, when in the UK we had 18,738 deaths? Boris Johnson was out of intensive care by then, but not back to work. What would your level of trust have been a month later, which just happened to be the very day that The Guardian and the Daily Mirror broke the story on Dominic Cummings breaking the lockdown regulations? And what is your level of trust today when we're not quite 3 months on? So if your trust, or if public trust in COVID-related data practices has changed, I think that we should ask why. And I don't think that answer is going to be exclusively around the use of that data. You know, when we think about it, data, digital data, it's a material that's used in scientific practice. But you know, somebody made a really concise statement, and they said, you know, until we address the biology, we cannot address the economy. And I think that speaks to the need that we have right now to both contain and reduce the presence of the virus in our community, because until we do so, we can't fully return to any kind of pre-pandemic life. And this really requires that we work off of evidence-based advice from experts. I'm sure many people saw the headlines today that had we entered lockdown a week earlier, we would have had half the number of deaths that we've had. So I think, you know, in terms of data, in terms of skepticism, in terms of trust, when we talk about following the science, or if there's a claim that we follow the science, does that necessarily mean governance that's based on the best available evidence-based expertise? So I think it's important that if we're asking questions about the credibility of data sources and their use, which we should do, just to be perfectly clear, and if we see debates around the interpretation and the analysis of data, I think that has been more of a political issue than necessarily a scientific one. And I don't say this in a naive way to suggest that there's a straightforward or there's simple scientific data-driven solution. But I think that there are clearly better practices that are data-driven. And as we go along, I'd like to highlight a few of those different kinds of data-driven practices.
Yeah, absolutely. Thank you. I mean, on one hand, then, I think skepticism over what data is telling us, much of which is healthy, and perhaps we've all become a little bit more data literate over the past few weeks. And then you've got that skepticism and also the role of data in politically driven decisions. And then on the other hand, you sort of have a situation where large scale monitoring and tracing is positioned as a solution for living with the pandemic. And actually looking to other nations, it's certainly worked. So how do we navigate this conundrum, skepticism on the one hand, and then the solution and monitoring on the other?
So my headphones are telling me I should have recharged them, so I'm just removing.
Oh, yeah, Mark, if you can enable the microphone on your computer, fantastic. Then we'll get there. No, that's great. We don't want to miss anything that you're saying. That's all.
Can you hear me now?
Perfect.
Okay, sorry about that. So let's look to other places where there have been data-driven solutions to living with the pandemic. And I mean, maybe the best example is South Korea. Now, it's not fair necessarily to do a straightforward comparison. I mean, South Korea was hit hard by SARS, and so they entered the pandemic with a much more agile and resilient structures that were already in place. They had rapid testing capacity. They'd already enacted legislation giving government authority to collect mobile phone, credit card, and other data from people who test positive to reconstruct their whereabouts. Even relevant information was shared on social media apps, allowing others to determine whether or not they'd cross paths. Most recently, and I just saw this yesterday, they're now setting up QR readers in all sites of public gathering that are determined to be high risk. So everything from fitness centers to clubs to karaoke bars. And so people, if they want to go into these sites, they have to download an app that uploads basic contact information. They have to scan the QR code when entering the facility, but that data is encrypted and it will be destroyed in 4 weeks. And in fact, facilities that don't comply will be given a warning and or face shutdowns. So there's an example that's fairly comprehensive. And people in quarantine have to wear electronic wristbands also. So it's worth thinking. It's worth just noting in South Korea, there's been 12,000 cases so far, hit earlier than the UK, and 270 deaths. And just a reminder, these are yesterday's figures here. We've had 290,143 cases and 41,128 deaths. If we had time, we could talk about similar practices in Taiwan, Singapore, Japan, Japan, which has almost double the population of the UK, they've had 17,000 cases and 900 deaths. So this is not to say that it is strictly data or technological practices that result in lower cases and death, but I think it is undeniable that it helps to attenuate, to more effectively address the conditions of the pandemic. And I think it's worth our collectively thinking about what are the kinds of assumptions that we make if we are automatically dismissive, especially of East Asian countries in terms of their more robust engagement with data. I think it's worth thinking about what kinds of exceptionalism we imagine from our position in relation to that. And I don't say that lightly, and I don't say that in a way that also suggests we should just accept widespread data valence, but because I think that there are, and we'll talk about this, options for privacy preserving approaches to more robust data engagement.
Yeah, absolutely. And I think we'll come back to this, but the lack of trust on possibly politically driven will affect how the track and trace solutions in the UK operate, I think, and the take up. as you mentioned, this isn't just about the collection of data, it's everything around it as well. So just to kind of move to the COVID-19 apps and the track and trace systems in the UK. I mean, how are they going to work?
How are they going to work? So, I mean, when we talk about mobile apps related to COVID-19, they tend to do three things. The most prominent is contact tracing. So this is just a means of monitoring the interactions that we have with leaving a digital record of that. And so it's really being used, it's also being used sometimes to monitor and regulate movement in Taiwan, for example. They do it to monitor people that are in quarantine, but the data is being used to aid epidemiological modeling. The C19 app that was put together by some of my colleagues at King's has been gathering really interesting data for the last 3 months. So contact tracing, how it's being implemented is not, I think it's important to note that it is not primarily a scientific decision. It's a decision that's driven ultimately by political choice. I want to just give you an example, and let's take one slightly closer to home, and let's look at an example in Canada where Joshua Benjo, who's a leader in machine learning, his lab has put together a privacy protecting decentralized system. It uses GPS and Bluetooth. It tracks location and interaction. It uses advanced machine learning for more robust and informative digital tracing because it brings in everything from data from medical conditions, and it gives a more graded and precise estimation of infection and contagion risk. It can provide more personalized risk awareness and recommendations to users, but also linkage to health services and the data that's non-identifying. So it's anonymized, it can be shared to improve epidemiological modeling. So we can do that. We can do that through contact tracing. I think maybe some of the listeners, those who work in marketing, might be already familiar with the basics of contact tracing using Bluetooth through, for example, proximity marketing, right? And within the field of advertising marketing, proximity marketing is often referenced as communicating with customers in the right place at the right time, because there's beacons in an environment, in a store, and maybe Google has a beacon, and then if you search for something, then it links up to Google Ads, so that if you then go follow up and go to a store, right? So these things are already in place. The crux of the issue tends to be around who is storing the data and or where is it being processed, and therefore what can be ascertained from that. And I think that that is an area that rightly impacts upon levels of public trust. And I would suggest that the path that we followed in this country has been one that has ignored most expert opinion in terms of more privacy preserving methods that are already available and could have been implemented because they were ready to go off the shelf back in March, actually, not even April.
And are they things like, I mean, is that about, for example, you mentioned South Korea, so the destruction of data after 4 weeks, and having things like that built in, is that an example of that?
Well, that's an example of that. The one thing that I think that's helpful is to think in terms of COVID-19 apps as being centralized in terms of data storage or decentralized. Australia also followed a centralized model, and their app was considered an abject failure. There was widespread concern over third-party data sharing, and it just meant very few people actually adopted the app. So it wasn't useful. It didn't really serve any good purpose. Decentralized apps we're seeing in Germany, we're seeing in Italy, we're seeing in Singapore. It's really interesting to note that our government has actually even gone against Google and Apple in an unprecedented endeavor have cooperated, but they've demanded that there is decentralized data storage, and there's been big problems with that. So to be just for a moment a bit more technical, there's kind of two camps. One is known by the acronym PEPPT, so PEPPPT, which is the Pan-European Privacy Preserving Proximity Tracing, and that's just a consortium of open source contact tracing solutions. This is back in March. And I don't think that we should think that that people that are proposing this have any kind of malicious intent, because the idea was that the data would be stored by the country's health service, right? And to be used for primarily epidemiological purposes, but it's centralized storage. And then there's something called DP3T, which is decentralized. It's much more transparent. All data is stored on mobile devices. And that's what Google and Apple wanted, in part because it impacts on the functionality of mobile devices, because these apps need to be on all the time. If people are really interested in this, we can provide some links. There's some technical documentation on GitHub, and there's a good piece in the tech section of New Statesman that I would pass along. But just to really simplify, Bluetooth is used to track the proximity to others. So if a user, so whenever you're in the presence of someone else's phone, that interaction is being recorded. If you test positive, the app runs through all of those contacts that it's stored over, a previous period of a few weeks, and then it assesses a risk score on the duration of the proximity, and the degree of the proximity. So how close, how long, and kind of population level epidemiological factors. And then there's a push notification that says self-isolate. So one of the problems is there's persistent identifiers with your phone that are involved in this, and then there's ephemeral IDs that go. And if they're stored on a phone or a server, then also if that risk calculation, so sorry, I should clarify, those can be stored on your phone or on a centralized server, and the risk calculation equally can be performed on your phone or a centralized server. The issue that many have is that if it's centralized, then that allows for a function creep, right? That actually allows, and they've already demonstrated this through some technical analysis, of learning much more about a user's social graph, which is basically who you are, all of those likes, things you do, so all of that can potentially become available. So there's a good reason
that we give to Facebook willingly, though. This is the stuff that we're telling private organizations willingly in exchange for services anyway. Mark, just to firstly, I want to remind everyone listening that we've got some space for questions coming up, and whether this is about COVID-19 apps, and thank you, Mark, for that, in terms of explaining how they work. And I think the difference between the decentralization or the centralized model, I think is incredibly useful. And we can follow up with some resources for everybody afterwards. But please do, we had 2 questions come through pretty straight off the bat, so that's a good sign. But please do put some questions in the question and answer box, and I'll come to them in a minute. So Mark, we've looked at, I guess, some of the context around, where we are with respect to data and apps. But thinking more long term, what's happening now, will that change how public health data is perceived, is collected, and how we as individuals feel about how our public health, our data, our health data, do you think?
Yeah, I mean, I think that's a really interesting, and in fact, it's a crucially important question. We first started to think about this very early on, and I think we can all, if we go back again a month, 2 months, and we remember that very real kind of existential anxiety that most of us kind of felt. And at that point, we were thinking about COVID-19 apps as almost like, how can this help? Because we really desperately need help addressing and kind of containing the pandemic. And we also thought that this was a potential opportunity to have a more holistic approach to data and to think about the relationships between us as individuals collectively and our broader ecosystem. That's why a project that we're working on, we kind of flip the phrase, we talk about critically assessing public data health and then, public health, the use of public health data to rethink public data health, right? And I think that that's an interesting way to think about it. So in the emergency conditions, in pure pandemic conditions, it's public health data that we're utilizing to contain. But in the longer term, what does this mean for public data health? And we've seen, in a way that wasn't necessarily expected, we've seen socioeconomic factors that have been significant in terms of, not in a biological sense, there's nothing, but it's about how race and class, to put it in the most straightforward terms, is being biologized, right? It's and impacting different communities in a massively different way. For example, that kind of data up until now hasn't been taken into account in how we're addressing COVID-19. And once we get past the initial emergency stage, how might we utilize that differently? But in a way that obviously would require significant public health, because communities are going to be like, well, why would I want to share my data in a way that could be used to increase kind of structural prejudice toward me in the first place? So these are all really difficult questions. And to be honest with you, they're not being made any easier by the ways in which many governments, including this one, is approaching this problem, where it's actually much more business as usual. And there's a clear desire in this country right now to have centralized data storage, because and there are data companies that are connected to high profile people, including Dominic Cummings' company. This is simply factual, where the contracts are redacted and the terms under which they're using data is unclear. This is not an environment that creates public trust at a time where we desperately need it. And the technology this is not a difficult technical problem. It's a political problem. And I think that's one of the most important messages for SMEs, for any enterprise person that's listening in here, is in terms of how will your client, your customer, your community that you're engaging with, how are you utilizing their data, and what kind of relationship and what kind of agency and what level of transparency is there over that relationship?
Yeah, absolutely, Mark, and thank you so much. We're going to turn to questions because we have some really good ones coming thick and fast now. And one thing I want to flag to people is that your work, Mark, focuses around how communities can sort of, I don't really like the word be empowered with data, but can actually take control of this data that is being collected about us. And I think for people out there, I mean, that's an area that I'm passionate about as well. I mean, that's kind of incredibly important. And I think perhaps is now coming, and there's a lot of momentum behind that. And I think surely more as a result of COVID-19. However, I've got to turn to some questions. So first of all, we'll just on the subject of the COVID-19 apps. So from Chris, we've got, is there any data on how good the data is from these sort of apps? So do people misreport? They might, due to a lack of understanding, lack of caring, or fat fingers, so to speak, or deliberately misreport. Any views on that? What kind of percentages might be misreporting?
So I think in this instance, we can make a distinction. Before, I was talking about the use of COVID-19 apps to aid epidemiological modeling, and that's an example of that will be the C19 that Tim Spector and folks at King's have put together. No doubt there's malicious reporting to some extent. I mean, I'm not a modeler. I think that they would try their best to account for that. If you take, on the other hand, contact tracing, there's something actually quite elegant about the Bluetooth approach, insofar as you have no meaningful control other than where you go and who you're near, because it's really, the point is that the Bluetooth is interacting with other phones. So it's different. And then you would need to misreport, which I suppose you could do, but in some countries it requires a kind of formal testing with the health services of that country. So again, to do that would be a little bit more difficult. So I would suggest that if we're talking about decentralized data storage for a contact tracing app, there's not a tremendous amount of downside, especially if this is a time-bound process. That means, if it's decommissionable, if that's been built into the design so that the data both is ephemeral over a period of time, it's kept in a decentralized way for a period that is ascertained by health services. And if in fact that's not a kind of a permanent app, then it's something that doesn't easily lend itself to more malicious use, but makes tracking and containing eminently easier.
Yeah, absolutely. And this sort of leads to another question we've had, which is about the destruction, the deletion of data. So how do you know data is destroyed? Who's guarding the guard? And what are the options for that?
Yeah, that's a good question. I want to kind of turn that back on people, and I want them to ask that question equally to Google, to any number of retailers that use the same beacon technology and Bluetooth technology for proximity marketing. How long do they keep that data? What purposes do they use it for? I'm betting that people, other than people that work within marketing campaigns or are in management at those retail outlets, would have no answer for that whatsoever. Now, that's not saying that that's good and we shouldn't worry about that, but that's just to kind of, it's really interesting to think about how questions that we should be asking become really pronounced when we're dealing with a pandemic, but are less apparent, maybe just because people don't know about it as much when we're talking about it in the way that it's already infiltrated in our everyday life. But I think to answer that in a more straightforward way, these things can be designed into the app itself, right? And I think that I along with a number of other colleagues, we just had a piece in Transactions on Data Privacy entitled "Give More Data, Awareness and Control to Individual Citizens, and They Will Help COVID-19 Containment." Luciano Floridi's team at the Oxford Internet Institute just published a comment just a few days ago in the scientific journal Nature on ethical guideline for contact 19 tracing apps. And I mean, the idea of having privacy preserving, user control, this is across both pieces, the purpose of data collection being defined, it being open sourced, it being for a limited time, it having kind of decommissionability built in. These are all set forward as kind of standards that are necessary if we're going to have an ethical approach, and one that people can, with meaningful trust, take this up and say, this can actually help us in this historical moment. So again, these things are eminently possible.
Mark, you've touched on ethics and also Luciano Floridi's work, which will be familiar to some people. And we had a question come through, early on. A brief answer, if you will. Is Facebook an ethical company?
Way back in 2006, I think it was, I wrote my first piece on social media platforms at a time where Facebook was so new that it barely fit in a footnote, because we were actually talking about MySpace. In that time, I've kind of watched Facebook and seen this kind of technologically mediated social experiment grow, and from being an avid early user to seeing, I think what we saw last week in terms of Zuckerberg's response to Donald Trump's posting probably is troubling many people and pushing people to the edge. I would say that there are many many, many ethical people that are working in Facebook, and that's evidenced by the consternation that's arisen within that company. I think that their practices are becoming harder and harder to defend because it's really quite clear that it's an environment that allows for a certain kind of communication, affective communication, non-rational, non-data-driven, non-evidence-based communication, which is impacting profoundly politics. If you look at some of the wild disinformation linking 5G, et cetera, to COVID-19 early on, I mean, a lot of that is happening through not just Facebook, but Facebook being one site. So Facebook is really, it's on the ropes from my perspective. But then again, you know, 1 billion plus people use it, and it allows for meaningful interaction, and that's difficult to give up.
Absolutely. And having had a fascinating conversation yesterday with Elastos about Web3 and, you know, the open data web and some of the stuff that's coming there. I mean, it could very well be that change is on the horizon. Very last question, and really briefly, what is next for the UK's Open Data Institute?
Well, I've done research. I've done some research projects with the Open Data Institute some years back. And I mean, that's another area where there was great promise. And I think there still is great promise around the very concept of open data. And I think open data and the idea of data as more of a public resource. Even just last year, I was part of a workshop with Nesta, where Nesta is looking at that same issue. I think that I can't speak institutionally to what's happening at the ODI because most of the people that I was working with are not at the ODI anymore. But I think that there's still a strong role. I think Tim Berners-Lee is somebody who we look to for his very positive and timely interventions that he has as a reminder about, you know, what this distributed network that's transformed our lives can potentially be, which is something that's not primarily sort of proprietary and closed and black boxed, but open and transparent. And, you know, I think that we shouldn't be afraid to say empowering, because I think that it is and it can be. So I hope that idea that they will continue to contribute to improving, you know, what we've taken to calling public data health, because it's something that in the longer term, you know, in the same way that somebody, there was some graffiti that went up not so long ago that said something like, you know, we can't go back to normal because normal was a problem in the first place. I think that, you know, I hope that public data health can improve coming out of this pandemic, as opposed to rushing back to more of what's partially got us in this place in the first place.
Mark, I think that is a fantastic note on which to end. I'm sorry to have to bring the discussion to a close, because it's been really fascinating, and I hope that our sort of listeners and our audience have found it useful. I'm sure they have. I think there's lots of principles for organizations who are really working hard, I think, to formulate a data culture and data literacy across the organization. And I think today's discussion has shown how important that is. So thank you so much to you. Fantastic to have you. I hope you've enjoyed it.
Absolutely. It's been great.
Fantastic. So thank you to everybody for submitting questions and for listening in.